Today on Dr. Osborne's Zone, we're going to be talking about a nutrient deficiency that has plagued pirates and sailors alike. We'll be right back. You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over to Dr. Osborne's Zone.
He's out of his mind completely, Ross.
You've been out water a long time, haven't you?
What the joke of me, man, Ross, and you don't got enough.
How about food?
Could you say that again, please?
That scurvy dog. The movie Waterworld was actually trying to portray a character that had scurvy, and that's what you just watched. Now, what is scurvy? It's a disease state caused by vitamin C deficiency, and that's the topic of today's show on Dr. Osborne's Zone. So without further ado, let's break vitamin C down. Now, it has several different functions. I like to refer to vitamin C as human duct tape because it's so critical for so many different functions, and without it, the body starts to fall apart, hence duct tape. But if we look at those functions here and just kind of summarize some of the key ones, it plays a role in the formation of dopamine through the metabolism of the amino acid tyrosine. It plays a role in folate metabolism. Folate's a B vitamin, vitamin B9 specifically. It plays a role in how we produce the neurochemical serotonin, which regulates pain and happiness. It plays a role in collagen formation. Most people know vitamin C by this role. We'll dive a little bit more deeply into that shortly. It regulates cholesterol. It plays a role in immune cells and how they respond to threats. It helps with lysine metabolism also to help form collagen. It forms or helps in the production of carnitine. Interestingly enough, a lot of people today, not even so much keto as carnivore, going on a carnivore diet. When you're on a carnivore diet, one of the functions of carnitine is that you use it to shuttle fat so you can metabolize fat or burn fat as energy, which requires carnitine to do that. But when you're on a carnivore diet and you're not eating adequate liver, what happens is you don't get any vitamin C. And of course, vitamin C is necessary to form carnitine. And when you're eating predominantly protein and fat, you need that carnitine shuttle to metabolize that fat. And this is one of the most common deficiencies we see in people on carnivore diets. Interestingly enough, because you get carnitine from eating animal meat, but I think it's because of the fat metabolism, the need for that is so great. We know that it's important for adrenaline formation, the catecholamine adrenaline. We know that you need vitamin C to make bile acids, and you also need vitamin C to form nitric oxide, which allows blood vessels to dilate. So lots of different functions from one nutrient, and without it, we're in deep trouble. So here is just a few kind of prettier summaries of the role of vitamin C. And a couple of other different things here. As you can see here, vitamin C plays a major role in the formation of antioxidants or antioxidant function. It scavenges free radicals. Vitamin C is also very, very important. It's not on here, but in the chelation and detoxification of heavy metal, especially lead. And so there are a number of studies that show that people with vitamin C deficiency have higher lead, and vice versa, people with higher lead deplete their vitamin C stores. As I mentioned before, dopamine synthesis for noradrenaline, hormone synthesis, as well as iron absorption. Vitamin C enhances iron absorption, and so those of you who maybe have a diagnosis of hemochromatosis, which is a disease of iron metabolism, you have to be cautious around higher doses of vitamin C intake. It's not that you can't use vitamin C, it's just that you better monitor your iron levels and make sure that it's not spiking you unnecessarily. And then of course, collagen production, as I mentioned earlier, carnitine synthesis. but also the regulation of gene and epigenetic erasers, gene expression and epigenetic erasers, and other amino acids like lysine and arginine and tyrosine plays a role in all of their metabolism and function. If we look at vitamin C's functions in the immune system itself, you can see it's got different roles. This review on vitamin C broke it down nicely in between innate immunity and adaptive immunity. And so you can see here with the neutrophils, this is your army, if you will, of your white blood cells. It enhances their migration in response to what's called chemotaxis, which is when there's a stimulation or a damage, whether it's inflammatory or infectious. It enhances the engulfment or the phagocytosis of microbes. So neutrophils have a kind of a Pac-Man-like effect where they will eat up microbes or their chemicals. It stimulates free radical generation and the killing of microbes through neutrophil stimulation, and it supports caspase-dependent apoptosis, so it helps with cell destruction. In macrophages, it enhances uptake and clearance, vitamin C does. Vitamin C aids in the maturation and proliferation of natural killer cells. Many of you may have heard of these, but where they very critically important is in basically in modifying or destroying cancer cells. We also have the vitamin C regulation or differentiation of Th1 types of T cells, so T helper cells, generate CD8 memory T cells, activates something called FOXP3, which is a master transition factor, regulates the activity of regulatory T cells. So a lot of immune response or immune regulation around vitamin C. You can see down here it also helps to increase IgG production or levels as well. So vitamin C critical for immune function. As a matter of fact, one of the ways that many doctors believe that vitamin C should be measured is not in the serums. It's common that serum levels, it's a simple blood test that can be done through LabCorp, Quest, and serum levels just measure quantitatively how much ascorbic acid is floating around in your blood at any given moment in time. But many researchers believe that it should be measured in the white blood cell. And this diagram that I just showed you is one of the reasons why, because vitamin C plays such a huge role in immune regulation. But we also believe that because white blood cells have a longer lifespan of about 6 months, that measuring them in the white blood cells is a truer indicator of dietary uptake and overall storage status of vitamin C, as opposed to just looking at it in terms of serum. Okay, this was a really good review published a few years ago on kind of a conglomeration of the different functions of vitamin C, just simply put. So if you want to screenshot this, as I just showed you the immune functions, catecholamine and neurotransmitters, this is dopamine, serotonin, and adrenaline. The production and maintenance of collagen, that's for your muscles, tendons, ligaments, blood vessels. Many of your tissues in your body contain and need and survive and thrive with healthy collagen. And then as well, the synthesis of cortisol and the endothelial vasodilation and barrier function. So this has to do with nitric oxide. Vitamin C's role was elaborated or elucidated and helping blood vessels dilate and helping to seal the barriers. For example, your blood-brain barrier and your gut barrier, your kidney has a barrier. So very, very important in that regard. So now that you kind of understand the synopsis of functions of vitamin C, that's going to help you with some of these other things as well. Now, what I just showed you was the functions, and so if we look at where vitamin C is stored, some of the highest concentrations of where it's stored, one of them is in your adrenal gland. And as we just talked about, why the adrenal gland? Because the adrenal glands use vitamin C to make cortisol and adrenaline, right? So think of vitamin C as a major stress support. When you're under a lot of chronic stress, whether it's emotional, physical, or biochemical, you will burn through more vitamin C as a natural course to try to cope and adapt to that stress. And so cortisol and adrenaline are two of the main hormones that help you to do that. We know that vitamin C is concentrated in the liver and the brain. Specifically in the liver, one of vitamin C's functions is the regeneration of glutathione, which is the master antioxidant that helps the liver go through detoxification processes. In the brain, of course, there's dopamine and serotonin, neurochemicals that are critical for brain function. And so there are certain areas of the brain that have a lot more concentration of vitamin C storage, and in the muscle as well. We know, for example, research in humans, especially in athletes, show that vitamin C supplementation reduces soreness and enhances their ability to continue to perform. We know that vitamin C deficiencies can increase damage to the tendons, which is the area, that area of the muscle, the extension of the muscle that lacks a really great blood supply that attaches to the bone. And so tendinopathy, or people that have a kind of a predisposition to developing strain sprains in that way, have a greater risk of vitamin C deficiency, or oftentimes have vitamin C deficit. This is a diagram showing in a little bit more detail quantitatively how vitamin C is stored in which tissues, and quantitatively how much. I want to point out this highlighted section. The human body contains 1.5 grams of vitamin C, in essence about 20 milligrams per kilogram of body weight, and loses 3% of its vitamin C content per day. So that's lost mainly through the kidneys. Plasma and leukocyte levels of vitamin C reflect the amount absorbed from the digestive tract. As I was saying earlier, leukocyte's a white blood cell, and so what I was saying was researchers think that looking at vitamin C in white blood cells is a more accurate representation of vitamin C absorption and storage, making them important to consider when evaluating the bioavailability of vitamin C. So if we look at these tissues, you'll see just from a pure quantitative standpoint, we've got down here, these are white blood cells. So the lymphocyte contains 3,800, the neutrophils, or rather the monocytes, 3,100. The platelets, almost 3,000 at 2,790. And then we come up here and we can see the adrenal glands, as I mentioned before, the stress response organ, and then the neutrophils at 1,350. And then from there, it just kind of goes down. You see brain 800 to 900, and these are micromoles per liter is the dosing here. And then, of course, skeletal muscle 200 to 300, spleen, liver, pancreas combined 600 to 900. So this shows you where vitamin C works, right? So where it's more highly concentrated, as a general rule, is where, it's not to say that in tissues where it's less concentrated, it doesn't have a function, but in those key areas, we see a lot of its functionality play out. Now, that being said, let's talk about the symptoms of vitamin C deficiency. So now you kind of understand some of its functions. Let's talk about symptoms. So I'm gonna show you a lot of research, human research, because I think it's important that we make this about people, not animals, as much. But some of the common symptoms: bleeding gums, anemia. This is especially iron anemias, our iron deficiency anemias, muscle and tendon degeneration or pain, varicose vein formation, or what are called skin petechiae, where you have broken blood vessels around the follicles in the skin, slow healing, recurring infections, as I mentioned before, heavy metal toxicity. So these are some of the symptoms that we know people with vitamin C deficiency can develop, and it's not just those. I want to elaborate and expand on this. So let's pull up some additional research. I like the title of this paper, which is "The Troubling Rise of Scurvy." And the reason I like that title is because what are we commonly told by our doctors? Scurvy doesn't exist. In the modern world, there's no such thing as scurvy. And the reality is, I see scurvy in my own practice a couple of times a week. And I don't have a high volume practice. It's not like I'm in the ER or in a clinic where I see 50 people a day. I might see 7 or 8 people a day in my practice. And I see scurvy a couple of times a week, as defined by low ascorbic acid levels in the bloodstream, but also as defined by clinical findings. So the troubling rise of scurvy, meaning that this disease does exist. And when your doctor gaslights you and says, oh, there's no such thing as scurvy in America, ask for more, ask better, especially if you find yourself in the pickle of having some of these symptoms. So here we go, an introduction. In the era of modern medicine, scurvy has been thought of as a rare disease of ancient times because of improved emphasis on diet and nutrition. However, isolated case reports are plentiful. If you want to go online and do some Google searching in the National Library of Medicine, you're going to find more than you can possibly read as far as case reports on vitamin C deficiency scurvies. And that's what these authors of this paper are talking about. And so in this particular study, they were looking at the rise of scurvy over time. And so they found that the incidence of scurvy increased over the study period from 8.2 people per 100,000 in 2016, meaning what this means is 8.2 people were diagnosed with scurvy out of every 100,000 people in the year of 2016, to an increased 26.7 per 100,000 in 2020. So that is in essence, it's a more than a 300% increase in diagnoses in a 4-year period of time. What they found was that patients with scurvy were more likely to be younger, male, and in the lowest income quartile. They were also obese. A majority, 64.2%, had a concomitant diagnosis of autism spectrum disorder. They also had common presenting musculoskeletal reports, including difficulty walking, knee pain, and lower limb deformity. Now, I want to highlight some things. One of the commonalities with people with autism, when we look at autism, is they have, we'll just say texture issues with food. And so they are, many autistic kids, young men, so to speak, are very, very meticulous about what they will eat. And so it's interesting that these researchers are finding that 64% of these scurvy cases are in autistic kids, because texture issue, a lot of these kids won't eat fruits and vegetables in adequate quantities, which is where we predominantly find vitamin C. So at any rate, I think it's alarming to see researchers finding a 300% increase in scurvy, although I don't think it's really an increase. I think what it is I think it's just maybe awareness. More doctors are waking up to the fact that nutrition is important, and I think we need to expand that much, much more. I think if we do, we're going to find that scurvy is actually a common disorder today, not an uncommon disorder. Let's look at this case study here. So 74-year-old Caucasian female presented with a history of acid reflux, irritable bowel syndrome, and presented with a 3-month history of persistent painful mouth ulcers or oral ulcers and recurrent episodes of joint pain, of what they called non-specific arthralgias, which is basically joint pain. She was referred to rheumatology and had an extensive workup, and that demonstrated that she had positive protein titers suggesting rheumatoid arthritis. They gave her steroids, a Medrol dose pack, which only led to modest improvement, although her oral lesions persisted. Additional autoimmune testing demonstrated that she was reactive to gluten. She had gluten antibodies, that's what this anti-gluten here means, and that she also had positive anti-tissue transglutaminase. So basically, in this case, she was reactive to gluten. They found that her gastric anstrom, her small bowel, and colon demonstrated benign small bowel mucosa with normal architecture. So why is that important? Because this woman is reacting to gluten without villous atrophy. So normal architecture means she doesn't have damage to her small intestine that shows or that hallmarks celiac disease. And so a lot of times when doctors don't find this is kind of a hallmark key finding for them to be able to diagnose celiac disease. In this case, she didn't have it, but she did have antibody reactions to gluten. She also had positive HLA-DQ28 genotyping, which is a hallmark for gluten sensitivity as well. So enough evidence there, depending on the doctor, there's enough evidence there to help that woman go, or to help that woman, make that woman understand she needs to be on a gluten-free diet. Her vitamin C levels were undetectable, and they diagnosed her ultimately with scurvy, which was the right diagnosis. 2 months after the initial vitamin deficiency was identified, her clinical response was noted with improvement in her oral ulcers. So giving her vitamin C, where the steroids wouldn't take care of the oral ulcers, the vitamin C correction of the vitamin C deficiency did. As well, she had resolution of her petechiae, which are little hemorrhage blood vessels in the skin, and modestly improved joint pain. She was able to eventually transition to oral high-dose vitamin C once more compliant with a gluten-free diet. So in her case, what was going on? She was eating gluten, and of course, with gluten, you get damage to the small intestine. So we got gluten damaging the small intestine. And in this case, where does vitamin C get absorbed? It's important to understand that part. Vitamin C gets absorbed in the area where gluten does some of its most damage, which is the distal small intestine. So what this does is gluten damages the small intestine. It reduces absorption of vitamin C. And so in this woman's case, and what these doctors reported, is that oral vitamin C wasn't enough. It wasn't correcting her vitamin C deficiency well enough because she was still eating gluten, and gluten was damaging the area of her small intestine that absorbs vitamin C. So what they did was they bypassed her gut by IVing her vitamin C to get her clinical response. But really, ultimately, for this woman, it was the gluten-free diet that most likely led to the reduction of inflammation in the intestines that allowed her to absorb oral vitamin C. You can see here at the end, the patient also had a notable psychiatric history with prior diagnosis of depression, anxiety, and recurrent panic attacks, which may have served as a risk factor for vitamin C deficiency. Why? Panic attacks, anxiety, psychiatric disease. Well, what does vitamin C produce? One of the things it makes or helps you make is dopamine. Deficiency in dopamine, and it also helps you make serotonin. Deficiency of these can cause anxiety and panic attacks. And so that could have been part of why, they were thinking vitamin C as well based on that history. And then you see here, it's likely that her celiac disease and RA were largely responsible for her early symptoms, whereas later symptoms to include easy bruising were due to scurvy. Scurvy can mimic rheumatological disease, meaning vitamin C deficiency can cause the same symptoms that present in patients that have rheumatoid arthritis and spondyloarthritis and other forms of autoimmune arthritis. And so scurvy can mimic rheumatological disease, especially when arthralgias, synovitis, which is synovial fluid inflammation, or manifestations imitating cutaneous vasculitis occur. Why is that important? Because if you have been referred to a rheumatologist, let's say you've got joint pain and you've got swelling in your legs and you've got easy bruising and little rashes that are appearing on your skin and you don't know why, and you get referred to the rheumatologist, and when you go to the rheumatologist, they're going to spend several $1,000s in money. They'll bill your insurance, but they're going to spend that money on this tremendous workup. But how many of you have ever been to a rheumatologist and had your vitamin C levels checked? I mean, checking vitamin C levels in the blood costs about $80. It's not very expensive, and it might be the solution. And it might not be a rheumatological disease. You might not actually have an autoimmune disease, because think about it like this. If you get misdiagnosed, instead of spending $80 on a vitamin C test to confirm or disprove or prove scurvy, what do they do when you get the diagnosis? The first thing the doctor's going to want to do is put you on biologics. If you have an autoimmune pain, arthritis disorder, biologics cost thousands of dollars a month, but they also contribute to cancer in the long run. And if you don't get biologics, you're going to get other medications like methotrexate, Methotrexate causes leaky gut and folate deficiency, and that basically it shuts down your ability to synthesize new DNA and RNA. So it reduces pain, and it reduces the progression of autoimmune arthritis, but the consequence of it is actually quite bad long term. And then your other option really is steroids. And as we'll talk about here in a little bit, steroids deplete vitamin C. So if you actually don't have an autoimmune arthritis, but you have a vitamin C scurvy mimicking an autoimmune arthritis, and they put you on steroids, you're just going to make your scurvy worse. Okay, let's look at another case study on this. And notice we always see this term in a lot of these. We see a rare presentation of scurvy in a well-nourished patient. You see that with every case report of scurvy. They'll talk about how rare, but there's so many case reports, and as I showed you earlier, we see that incremental rise in the ability of doctors to recognize how much scurvy is increasing. You see here the prevalence of vitamin C deficiency varies worldwide, with the United States reporting rates as low as 7%. Now, I point that out because 7% of the population has scurvy, according to reports in the US. 7% is not a small number. When you talk about celiac disease or gluten-related intestinal enteropathy, this is 1% of the population, and we have gluten-free food aisles and so much information out there about gluten. Many of you are just frustrated by it because you don't believe that anybody should have gluten sensitivity or be gluten intolerant. But 1% of the population has it for sure. But what we're saying here is that 7% have scurvy. But doctors will look for celiac disease. They will measure it, but very rarely will they ever look for scurvy when it's 700% more common than celiac disease. You see here, humans lack the capacity to synthesize ascorbic acid, but this organic substance is essential to the human diet due to its role as a cofactor in many metabolic processes, the most important being collagen synthesis. This is one of the hallmarks for the symptoms associated with vitamin C deficiency. Because collagen is the basis for your connective tissue, your blood vessels, which is tunica media and tunica adventitia of the blood vessels, and then osteoblasts, which are bone-building cells. So your protein in your bone is collagen, so bone remodeling is dependent on vitamin C. So in individuals who eliminate foods high in ascorbic acid from their diet or suffer from malabsorptive GI conditions like celiac disease, vitamin C deficiency can present with classical scurvy symptoms. Without dietary ascorbic acid, collagen fibrils are not properly formed, leading to symptoms of deficiency. We'll talk about those here. Actually, let's just go ahead and highlight a few of them. Classic symptoms include mucocutaneous petechiae. This is like hemorrhaged tissue, poor wound healing, slow healing, ecchymosis, which is like pulling of the blood under the skin, hyperkeratosis. So if you ever take your arms and run them across the back of, or your hands and rub them across the back of your upper arms, if that skin is nice and smooth, you're in good luck. But what I see a lot clinically, especially in kids, is there's big bumps on the back of the arms right here. And then if you look at it, they're super red and they look a little bit inflamed. That's called hyperfollicular keratosis. And so that's this symptom here, hyperkeratosis or hyperkeratotic papules or hyperfollicular keratosis. Those are all just different ways to say it. Corkscrew hairs, so little coiled hairs. Gingival swelling, so the gums swell and start bleeding. So if your gums are bleeding when you're brushing your teeth, that's like a hallmark that vitamin C may be a problem, deficiency may be a problem for you. And then rheumatologic problems include muscle and soft tissue hemorrhaging and painful arthrosis or arthritis. You see here, recent reports of patients with unresolved symptoms were found to have GI comorbidities such as inflammatory bowel disease and celiac disease, suggesting a malabsorptive etiology for scurvy. And this is what I was just showing you, the case study of the woman with celiac disease, ultimately was diagnosed. If you've got inflammatory bowel disease and you're not monitoring your vitamin C, you should be. Because if you have a disease that damages the bowel itself, you're gonna reduce your capacity to absorb the vitamin C, and then from that reduced capacity suffer the potential consequences. Here's here's what hyperfollicular keratosis looks like. If you can blow in up on this picture here, but you can see these red spots they're elevated on the skin. And if you look in there even closer, you can see little coiled hairs. Those are what are called corkscrew hairs. And then here's kind of a blown out version, and you can see down on the leg ecchymosis where that blood is pooling. So, you know, you see this area right here is just blown up right here. But that's what it can look like on the skin, and it doesn't always look this severe. Sometimes it starts out milder and it progresses and it gets worse. You see here in this case, vitamin C deficiency masquerading as vasculitis in a patient with Crohn's disease. Patient's diet was nearly exclusively made up of highly processed fast food with no fresh fruit or vegetables. We think about there's a current diet that's become very popular, which is the carnivore diet. And I know some people swear by the carnivore diet because they feel better on it. And this isn't not me saying those people are wrong. Their experience is absolutely right in their situation. I think one of the longer term risks of a carnivore diet done wrong is scurvy. And I've seen cases of that in actual patients being on a carnivore diet for extended periods of time. Because there are no fruits and vegetables on a strict carnivore diet. And so it's such a popular diet right now. I would just say those of you following carnivore, get your vitamin C levels checked. Now, if you're eating liver, you're going to get some vitamin C from liver. But if you're just strictly eating meats and you're not eating really anything else, I mean, there's a little vitamin C in eggs, there's a little vitamin C in liver, but outside of that, there's really not much vitamin C in animal food. So just be aware of it and get it checked. You see here, rash on the lower legs, mild gingival hemorrhage, and enlargement and muscle soreness were among this man's symptoms. Anemia and undetectable vitamin C levels were discovered in laboratory studies. The skin sample itself revealed follicular hyperkeratosis, which is what I was just talking about. Misdiagnosis, so if they had not looked for vitamin C deficiency in this particular situation, this is their thought. Misdiagnosis might result in unneeded treatments and medical expenses. Scurvy must be diagnosed as soon as possible because it might cause gastrointestinal or intracerebral hemorrhage and death. Scurvy can kill. I think it's important that you understand that. If it's left undiagnosed and it progresses, you can die from it. Okay, here's another one. Or musculocutaneous manifestations of scurvy. This was a man in his 20s. 6-month history of worsening left leg pain, weakness, swelling, and stiffness, which limited his mobility. He had generalized anxiety disorder. There's that anxiety again. Vitamin C, it's very, very common for reduction in vitamin C to cause anxiety. And this gentleman also had food allergies. The examination demonstrated left leg edema, so that with vitamin C deficiency, your lower legs can swell and retain more water, with ecchymosis. And so you can see that here, that's in this diagram right here, that's that pulling of blood underneath the skin of the thigh and ankle, and diffuse lower extremity petechial rash. So all this right here is that petechial rash. It's that rash that breaks out on the skin, and the reason that rash happens is because the tiny blood vessels in the skin are made out of collagen, and without vitamin C, that collagen is easy to break and rupture, and so it leads to this damage in the skin. Okay, let's look at another case study. This one you can see scurvy mimicking spondyloarthritis in a young man. Well, spondyloarthritis is what I was talking about earlier. This is an autoimmune arthritis, and the general treatment is methotrexate and or biologics, steroids, pain medications, or what are called disease-modifying anti-rheumatic drugs. All with tremendous consequence, right? So in this case, it was scurvy. It wasn't actually an autoimmune condition, but it was actually scurvy. 20-year-old male admitted to the department because of walking inability and back pain. You say vitamin C deficiency causes back pain? Absolutely, it causes back pain. And sometimes it doesn't lead to the severity. Sometimes it's so that, like, there are levels of deficiency, and so the lower and the lower your levels are, the more you get collagen disruption and damage that can manifest as musculoskeletal pain, i.e. in this case back pain. And this gentleman here, MRI showed bone marrow edema. This is another finding of vitamin C deficiencies, is edema in the bone marrow. of the sacroiliac joints in multiple slices and edema of both femoral heads. On MRI, if you've got periosteal edema or periosteal edema, that might be scurvy. That might be vitamin C deficiency. Some inflammatory characteristics of the back pain and radiologic findings were suggestive of axial spondyloarthritis, which is this disease here. Physical examination showed petechial rash and bruising in both arms and marked underweightness. His past medical history disclosed scurvy as well. Vitamin C supplementation completely resolved every clinical manifestation while he was hospitalized. We found low vitamin C levels, 0.2 milligrams basically per 100 milliliters. Really anything with vitamin C, anything less than 0.4 milligrams per deciliter in the blood is considered low. And if you get below 0.2, it's really, that's when they start considering scurvy. They also, in this gentleman, found high C-reactive protein, which is a protein released when there's inflammation. So we prescribed only adequate vitamin C supplementation and a balanced diet. After 1 month, low back pain completely resolved and the patient was able to walk. The ecchymosis and bruising disappeared. After 7 months, MRI of the sacroiliac joints and the femoral heads was normal with complete resolution of edema. So in this case, this guy could have gone on to a rheumatologist and been pumped full of toxic medications for many, many years. But he had a smart group of doctors that recognized that his problem wasn't autoimmune disease, his problem was vitamin C deficiency. Okay, let's talk about some of the diseases linked to vitamin C deficiency. Obviously scurvy, we've been talking about that for the past 10, 15 minutes or so, but also bone loss. Your bones require collagen as the backbone, so to speak, of your bone. The collagen matrix is what pulls minerals in and allows your bone to harden. But the collagen is the part of the bone that keeps your bone strong and elastic and resilient. And so without vitamin C, you can actually develop bone loss. And this is also true, you can develop OA, osteoarthritis. It's the arthritis they generally doctors diagnose as a result of people getting older. They say, oh, you're getting older, it's normal to have the arthritis. But osteoarthritis can actually be caused by vitamin C deficiency as well. Cancers, and we'll talk a little bit more about that. Atherosclerosis. Remember, vitamin C helps to dilate the blood vessels, but it also acts as an anti-inflammatory in the actual vascular lining. Type 2 diabetes, high blood pressure, schizophrenia, all been linked. And we can thank the great work of Abram Hoffer, Dr. Hoffer. If you haven't read his work on schizophrenia, if you have a schizophrenic in your family or struggle with schizophrenia yourself, I strongly encourage you to go look up Dr. Abram Hoffer and his books on treating schizophrenia with high doses of vitamin C. Okay, let's look at vitamin C and disease. So I thought this was an interesting meta-analysis. This was recently published a few years ago. Vitamin C can shorten the length of stay in the ICU. This was a meta-analysis where they took multiple trials, and these are all human studies, folks. So a number of controlled trials have previously found that in some contexts, vitamin C can have beneficial effects on blood pressure, infections, bronchoconstriction, atrial fibrillation, which is in the heart, acute kidney injury. However, the practical significance of these effects is not clear. The purpose of this analysis was to evaluate whether vitamin C has an effect on the practical outcomes, the length of stay in the intensive care unit, and the duration of mechanical ventilation. They identified 18 relevant controlled trials with 2,004 patients, and here's what they found. In 12 trials with 1,766 patients, vitamin C reduced the length of the ICU stay on average by 7.8%. In 6 of the trials, orally administered vitamin C in doses of 1 to 3 grams per day reduced the length of ICU stay by 8.6%. In 3 of the trials, in which patients needed mechanical ventilation for 24 hours, vitamin C shortened the duration of mechanical ventilation by 18.2%. So given the insignificant cost of vitamin C, even an 8% reduction in ICU stay is worth exploring. So vitamin C, I mean, it's pennies on the dollar. There's no downside really to administering vitamin C, but the upside in ICU is definitely there. I agree. It should be explored more because the benefits are probably greater if they played with the doses. I thought this was also interesting. So the history of scurvy and the use of vitamin C in critical illness. So this was a review, and this is findings of human research trials and what they found in hospitalization. So here's what they found with vitamin C. Sick patients, critically ill patients taking vitamin C. It reduced heart damage, myocardial damage. It improved myocardial stunning. It reduced vasopressor demand, it reduced atrial fibrillation, and it improved microcirculation. In the lungs, vitamin C reduced the duration of mechanical ventilation. It reduced the risk for alveolar inflammation and pneumonia. Vitamin C inhibited bacterial growth. It increased microbial killing, it increased endothelial barrier function, and it improved antioxidant scavenging. In the kidneys, it reduced fluid demand and increased urine production. In the brain, it increased the protection of neurons from oxidative stress. It reduced infarct volume after ischemia. And then in the blood, it reduced capillary plugging and it reduced sepsis-induced drop of thrombocytes. So a lot of benefits there in patients hospitalized by taking vitamin C. Let's look at this next one. Prolongation of survival times of terminal cancer patients by administration of large doses of ascorbate. So this was actually a study done over a number of years in 2 hospitals in Japan, and what they found, the average time of survival after the date of designation as terminal, so these were, again, terminal cancer patients, were 43 days for 44 low ascorbate patients and 246 days for 55 high ascorbate patients. So terminal patients without vitamin C lived for 44 days, and high vitamin C patients lived for 246 days. 3 of the high ascorbate patients were still alive, their average survival being 1,550 days by the end of that study. Similar effectiveness of ascorbate was also observed in the Kamioka Kozen Hospital, where they found average survival times were 48 days in non-vitamin C patients and 115 days for high ascorbate patients. One of the high ascorbate patients was still alive, his survival being 215 days. In addition to the increase in survival times, the administration of large doses of ascorbate also improved their quality of life. I mean, if we're talking about a terminal cancer patient, I mean, we want their quality of life to be improved. And when we talk here shortly about vitamin C's impact on pain and its ability to reduce the need for opioid medications while still maintaining good pain management, this is part of that quality of life, because terminal cancer can become very, very painful. And vitamin C, it's hypothesized that vitamin C plays a role in opiate metabolism. Let's see here. Here's another, this is a big review study on nutraceuticals effective for musculoskeletal health and cognitive function. I just wanted to highlight here, this was a pretty broad review, and they were looking at different micronutrients, vitamins and minerals, to see if they had improvements, if there were improvements in both musculoskeletal health, so muscles and bones, as well as brain function. And so they found a total of 16 nutrients with good science showing that these nutrients played a good role in improvement of musculoskeletal health and brain function in older people. And of course, vitamin C was one of those nutrients. And so I just want to highlight that. There were other nutrients involved here like omega-3, zinc, and vitamin K, and potassium, and B6 and B12. But vitamin C is what we're talking about today. So here's what I was talking about earlier with vitamin C and pain. So look here, epidemiological evidence has indicated an association between suboptimal vitamin C status and spinal pain. I showed you that earlier in a case study, but this is also true in general. Accumulating evidence indicates that vitamin C administration can exhibit analgesic properties, meaning vitamin C is a painkiller. That's what analgesic means in some clinical conditions. So surgical, trauma, infectious disease, and cancer patients are those conditions where there's good research. A number of recent clinical studies have shown that vitamin C administration to patients with chronic regional pain syndrome, also known as reflex sympathetic dystrophy, also known as dysautonomia, the chronic regional pain syndrome, it decreased their symptoms. Acute herpetic and post-herpetic neuralgia. So if you've ever had shingles, vitamin C administration reduces the pain. Is also diminished with high-dose vitamin C administration. So furthermore, cancer-related pain is decreased with high-dose vitamin C, contributing to enhanced patient quality of life. That's what we're just talking about. Herein we propose a novel analgesic mechanism for vitamin C as a cofactor for the biosynthesis of amidated opioid peptides, meaning vitamin C may be playing a role in producing natural endogenous peptides that act as opioids in the body. It is well established that vitamin C participates in the amidation of peptides through acting as a cofactor for peptidoglycine alpha-amidating monooxygenase, the only enzyme known to amidate the carboxyl terminal residue of neuropeptides and peptide hormones. Support for our proposed mechanisms comes from studies which show a decreased requirement for opioid analgesics. There's a lot of studies that show that when you put patients on higher dose vitamin C, they need less opioids to control their pain. And this is post-surgical. There are post-surgical studies. There are cancer patient studies that show this. Again, that high dose vitamin C reduces the need for pain medication. Overall, vitamin C appears to be a safe and effective adjunctive therapy for acute and chronic pain relief in specific patient groups. What I see clinically a lot is people that have actual rheumatoid arthritis and it's not been very controlled by their medication. What we tend to do is we give them high doses of vitamin C plus quercetin. And there's a synergism, and when I say high doses, I mean 5+ grams per day orally. And with quercetin, it's 4 grams a day orally. And this combination, in my experience, seems to doesn't work for 100% of patients with rheumatoid arthritis, but for a large percentage of people that we see, I'd venture to say 40 to 60%, it works tremendously well at helping control their pain while you're trying to figure out what's triggering the autoimmune response. Okay, I pulled this from the Linus Pauling Institute from Oregon State University on vitamin C and mortality. And so there have been a number of studies that show that vitamin C supplementation actually improves or reduces the risk of mortality. In this study of 77.7 thousand adults with 5 years follow-up, they found a small decreased risk of total mortality. Another meta-analysis of 14 studies found an incremental 100 milligrams a day increase in vitamin C was associated with 11% lower risk of all-cause mortality. Another meta-analysis in 2014 of 10 studies in almost 18,000 women with breast cancer found a lower risk of total and breast cancer-specific mortality with high supplemental and dietary vitamin C intake. So there's good evidence out there on vitamin C improving or reducing the potential for death. So this study here on high-dose vitamin C for a patient with myasthenia gravis and Crohn's, what they found, people at the highest risk for vitamin C deficiency are those with inadequate intake. Of course, alcohol is going to deplete vitamin C, malnutrition, poor diet, psychiatric disorders. A lot of medications that are given to psychiatric patients can reduce or inhibit vitamin C. Restrictive eating habits, food insecurity, and then malabsorptive, GI inflammation. In this particular case report, a 26-year-old woman with Crohn's colitis. She also had myasthenia gravis, which is an autoimmune disease that affects the muscles through the acetylcholine connection to muscles. And she also had juvenile rheumatoid arthritis. I don't know why they're calling it juvenile when she's 26, but nonetheless. She presented with frequent bruising, epistasis, and excessive bleeding from small cuts, and who was found to be deficient in vitamin C. Her plasma levels initially normalized with oral vitamin C supplementation, but bleeding symptoms eventually returned despite high-dose oral supplementation with 2,000 milligrams daily. I would say you probably could have gone very easily with her 5,000 and could have potentially corrected that. But they opted to do intravenous supplementation to help her, and it did. I would surmise that because she had Crohn's disease, the inflammation of the intestines was causing malabsorption, the oral dosing of vitamin C that they were giving her. Here is another case report of scurvy, vitamin C deficiency masquerading as reactive arthritis. So you can see the petechiae here in the image. You can see some of the corkscrew hairs and the image blown up. But the points of this, these doctors, basically their final points were patients with scurvy often pose a diagnostic dilemma because their presenting symptoms can lead physicians down a laborious and costly road of unnecessary testing, including testing for vasculitic disease, infectious disease, and rheumatological workups. The diagnosis of scurvy is clinical and typically is based on signs such as perivascular hemorrhage, bleeding gums, anemia, impaired wound healing, and ecchymosis on the setting of vitamin C deficiency with rapid resolution with supplementation. Now, I think it's important to just highlight something here really quickly, and that is, how many of you have gone to the doctor recently or lately where the doctor didn't even look at you, or the doctor didn't do a physical exam? They just maybe sat over near you and looked at the computer screen while you were talking and typed in some notes. These doctors are emphasizing the importance of scurvy being a clinical diagnosis. Here's what that means. You don't need to run a bunch of lab tests to diagnose scurvy. You just have to look at the patient. You have to look at their feet and look at their ankles and look at their skin, look at the hair growing out of their arms, look at inside their mouth and the oral cavity to see, do they have swelling in the gums? It's a clinical diagnosis. You can make the diagnosis in the clinic without having to run a lot of tests. And vitamin C is so inexpensive and so easy to take. It could be a tremendous solution, again, without going down the rabbit hole of looking for, esoteric autoimmune disease. Okay. This was a study actually published in 1976 in the National Proceedings of Science, and or the Procedure of National Academy of Science, by Linus Pauling. Those of you that may or may not know who Linus Pauling is, he was a famous doctor, Nobel Prize winner, who was known for using high doses of vitamin C. And in one of the in-life interviews that he did was a reporter trying to pick at him, and he said, "Dr. Pauling, what about all the critics who say that taking vitamin C is so bad and so wrong?" And Linus Pauling's retort was, everybody keeps telling me that high-dose vitamin C is a bad thing, but here I am, an elderly man, still working in my lab, still publishing and still doing research. And a large part of it is because of the vitamin C. Well, this was a publication that he put out, and in his cancer patients, and you see cancer patients significantly depleted of ascorbic acid. And in our opinion, this demonstrable biochemical characteristic indicates a substantially increased requirement and utilization of the substance to potentiate these various host resistance factors, meaning that people with cancer need more vitamin C to help fight the cancer. So the result of a clinical trial are presented in which 100 terminal cancer patients were given supplemental vitamin C as part of their routine management. Their progress is compared to that of 1,000 similar patients treated identically but who received no supplemental ascorbate. The mean survival time is more than 4.2 times as great for the vitamin C group, more than 210 days as for the controls that were 50 days. So the people that didn't get vitamin C lived for 50 days, the terminal patients. The terminal patients who got vitamin C lived 210 days. I mean, think about that in terms of, how do you put a price on that? I mean, over 150 extra days of life at the end of your life just with vitamin C, something so simple as vitamin C. Why isn't every cancer center in the country exploring this more? Well, the simple answer, in my opinion, is there's no money in vitamin C. It's not patentable, so you can't, when you can't patent a medicine, it generally gets put on the back burner, and I think that's part of what's happened with vitamin C. I really like this story. This was actually a researcher who wrote in to the American Journal of Public Health in the 80s, because she was reading in her books and reading her articles, as researchers did in the 80s before there were computers. It was all, dusty books and magazines, or rather journals. But what she was reacting to was the ink, the pollution in the ink in the journals, and it was affecting her eyes. And so she wrote in about her story. Anyway, this is part of it. Studies have been reported recently which suggest that there may be increased dietary requirements for ascorbic acid as a result of oral contraceptive use, smoking. Other reports have attributed depleted ascorbate levels to such diverse factors as stress, infection, collagen disease, aspirin use, and/or, keyword here, environmental pollutants. I mean, this is in the 80s, and of course environmental pollution has gotten a lot worse since then, because we're exposed to so many more toxic compounds and chemicals today than we ever have been. But we're also being exposed to radiative damage, from the use of 5G and 4G and Wi-Fi connections. I mean, they're so prevalent in our life today when they weren't in the 80s, hardly at all. So this doctor says, 2 years ago, my eyes began to tear and hurt when exposed to newsprint, photocopied materials in the print in certain books, things which a college professor is in constant contact. When exposed to fresh newsprint, freshly Xeroxed materials, or exhaust fumes, my eyelids exhibited a spasm-like blinking so that they almost shut. This involuntary blinking made driving difficult and hazardous. Now, she went to an ophthalmologist and she received different treatment. She was tested for different allergies, and none of that really worked very well for her. She was aware that ascorbic acid with its antioxidant properties has a protective effect against various pollutants. However, had initially viewed vitamin C supplementation as unnecessary, as so many do. So many people think, it's just expensive urine. Considering my supposedly adequate dietary intake, nevertheless, at this point, because medicine had failed her, she decided to begin taking a conservative level of additional vitamin C, just 500 milligrams a day. Within a week, she noted progressive improvement. At this writing, still taking the supplement, I'm almost asymptomatic. So 500 milligrams a day, took a problem that her ophthalmologist couldn't help her with, and resolved it. Seems like a simple solution. She said, it seems reasonable that for a variety of reasons, individuals may experience depleted tissue levels of ascorbic acid and thus could benefit from conservative vitamin C supplementation. Patient levels of ascorbic acid should perhaps be monitored more routinely, was her recommendation. Tests which measure cellular levels, i.e. white blood cell or leukocyte saturation, are probably more indicative of actual tissue reserves than serum levels. And then the note at the end, the editor's note, such individual observations have sometimes led to the generation of hypotheses and rigorous studies which serve to advance knowledge. So this is just her writing in. This woman was a doctor and a registered dietitian and a PhD. She was a professor of human biology at Wisconsin, Green Bay, just writing about her experience, fixing her eye problem with 500 milligrams a day of vitamin C. You can see here rheumatic manifestations of scurvy. This was 3 case reports in a large urban medical center over a 6-month period of time. 3 patients presented with symptoms including fatigue, purpuric rash, synovitis with effusion, so swelling synovial joints, anemia, and markedly elevated ESR, erythrocyte sedimentation rate, which is a marker for inflammation. They also had elevated C-reactive protein, which is also a blood marker for inflammation. 1 patient presented with severe pulmonary hypertension. Careful nutritional history revealed a diet deficient in vitamin C. Interesting there, this phrase. Careful nutritional history. How many of you have been to a doctor and they took a nutritional history from you? raise your hand or comment below. It's my experience, the vast majority of patients I see have never had careful nutritional histories taken on them by the time they end up in my office. But nonetheless, nutritional history revealed a diet deficient in vitamin C. Examination revealed, examination. How many of you have not had an examination? Examination is part of the job of the doctor. Revealed hemarthrosis, skin finding, characteristics of scurvy, and deficiency in vitamin C on lab analysis. Symptoms resolved with vitamin C supplementation. While scurvy is usually described in poorer countries, individuals who have psychiatric disorders or alcoholics with poor nutrition, it can occur even in otherwise normal populations in affluent countries, meaning it's not as rare as all the doctors are trying to tell you. Such patients often present to rheumatologists with rheumatologic symptoms, and awareness of the disease is necessary to make the proper diagnosis. So we've talked a lot about rheumatological disease and vitamin C. Let's talk a little bit about heart disease. In this case, right-sided heart failure and pulmonary hypertension. This was a 7-year-old boy with autism. He had a very restricted diet and presented with polyarthralgia, so joint pain in multiple sites. He had gingival hyperplasia or swelling, and he had pooling of the blood under the skin along with fatigue. His condition included pulmonary hypertension and right-sided heart failure, completely resolved with vitamin C supplementation. Pediatricians should have a high index of suspicion for scurvy in children with nutritional selectivity. In essence, this was another autism patient who obviously was peculiar about the diet. And be aware that it can manifest with cardiac symptoms. So vitamin C correcting right-sided heart failure. In this case study, effect of vitamin C supplementation on blood pressure. This is a meta-analysis of a lot of different trials. What they see here, 29 different trials that met eligibility criteria. Here's what they found, in the trials. What they found was reduction, with vitamin C, a reduction in systolic and diastolic blood pressure. So with systolic blood pressure, almost a reduction of almost 5 points, 4.85 millimeters. And then for the diastolic, 1.67. And then conclusion, in short-term trials, vitamin C supplementation reduced blood pressure, systolic and diastolic both. Long-term trials on the effects of vitamin C supplementation on blood pressure and clinical events are needed. I agree. It's hard to get money to fund trials on nutrition because the people funding the trials can't patent the vitamin C and corner the market. It's part of why patent medicine is so blatantly disappointing and has disappointed the health of Americans, because really all the money goes to studying drugs that come at a consequence, but very little goes to studying the nutrition, which is what the cornerstone of health is built on. Let's talk about things that can cause vitamin C deficiency. So you can see here, this is just a list of medications that can do it. So PPIs, proton pump inhibitors, drugs that block stomach acid, aspirin and other NSAIDs, non-steroidal anti-inflammatory drugs. It's drugs like ibuprofen. Ladies, if you take naproxen for your cycle, cramps and pain, you should know that you're blocking vitamin C uptake with that. Ladies, same thing here, not to pick on you all, but birth control pills. And this includes this also includes estrogen. Those of you who are on estrogen replacement therapies, I'm not saying stop your medicines. I'm just saying if you're on these medications, get your vitamin C levels checked. If you take diuretics for blood pressure, we just showed you that giving vitamin C lowered blood pressure, but taking diuretics reduces vitamin C. So by default, you take the diuretic long enough and you cause a bad enough vitamin C deficiency. Could you therefore not affect blood pressure in the opposite direction? If you take steroids, we know steroids deplete vitamin C. If you take heparin or Coumadin, blood thinners can also deplete vitamin C. So if you're on these medications, screenshot that and have a conversation with your doctor. We'll pull a few studies out on this for you. You see here, ASA, acetylsalicylic acid, this is aspirin. produced erosions. Now, we know that aspirin can cause erosions in doses as low as 7.5 milligrams per day, and a baby aspirin is about 85 milligrams a day. So that's, 11x the dose required to cause erosion. So we know that aspirin causes gastric erosions, mucosal erosions, and so leading to a marked increase in chemiluminescence, lipid peroxidation, and myeloperoxidase activity, basically inflammation. It also resulted in a suppression of gastric blood flow, meaning it reduced the blood flow to the gastric tissue. Intragastric vitamin C levels, also reduced vitamin C levels in the stomach, superoxide dismutase and glutathione peroxidase activity. So why is that important? Taking aspirin blocked vitamin C, block superoxide dismutase and glutathione. These are powerful antioxidants that offer protection. The addition of vitamin C significantly attenuated gastric damage and reversed the effects of aspirin on these parameters. So, look, if you're gonna take the aspirin, take the vitamin C to offset the damage. That's what this study is talking about. So, aspirin-induced damage. Vitamin C protects against aspirin-induced damage due to its antioxidizing activity. Now, again, keep in mind that vitamin C is depleted by aspirin, and you can also take vitamin C to protect yourself from the damage that aspirin can cause to your intestine or to your stomach. Okay, this one on vitamin C pain and opioid use disorders. So, a lot of you have asked me historically, what can I take if I'm addicted to medication to help get off that medication and reduce the potential for side effects? And so if you're addicted to opioids, if you're one of those people that have been prescribed pain medications for a really long time, and you've been on pain management and you're just trying to work your way down out of the medication, vitamin C is one of the best things you can do to help with that. You see here a powerful antioxidant, anti-inflammatory agent involved in glutathione recycling, that's vitamin C, a cofactor in adrenal steroid production and catecholamine production, that's adrenaline production and cortisol production. Vitamin C supports the synthesis of serotonin, modulates synaptic dopamine and glutamate, and may also enhance the synthesis of endomorphins and endorphins. What are endomorphins and endorphins? They're pain blockers. Natural pain blockers, and vitamin C helps you make them. In animal models, vitamin C reduces and prevents opioid drug tolerance and physical dependency. It irreversibly inactivates opioid stereospecific binding while increasing the anti-nociceptive effects of pain medications. It basically improves how well pain medication works, so you don't need to take as much. In clinical trials, vitamin C has been proven safe and effective in acute and chronic pain relief, including ambulatory, surgical, and oncological, that's cancer, settings. Vitamin C may temper the need for opioids, which raises the question of whether it can help reduce the risk of opioid use disorder, the people getting addicted to opioids. High-frequent doses of vitamin C may also abort cravings and opioid withdrawal symptoms in those with opioid use disorders and has better tolerability than other treatments. I mean, you can go to treatment centers and they can pump you full of all kinds of drugs, but vitamin C, in my experience, is where it's at. Proton pump inhibitors reduce the bioavailability of dietary vitamin C. After 28 days of 40 milligrams of omeprazole, the mean plasma vitamin C level had fallen 12.3%. We have shown that a short course of omeprazole will cause a reduction in the plasma vitamin C level of healthy volunteers. This decrease in plasma vitamin C is independent of dietary intake of the vitamin and indicates reduced bioavailability. So going back to just research showing that medication depletes the vitamin C. Okay, other causes of vitamin C deficiency. So we know certain medications can do it, but obviously poor diet. If you're following what we call SAD, Standard American Diet, high level of processed food, if you eat a lot of carbohydrates, a lot of refined sugars, this is going to deplete vitamin C. We know that mold toxicity can drive up vitamin C, or not drive up vitamin C, drive down vitamin C. You need vitamin C to defend yourself from the mold poisoning. So the mold toxins themselves will, your vitamin C will basically sequester to mold toxins and try to neutralize them. They're tremendous free radicals and oxidative substances. So you'll burn through your vitamin C. So if you're in mold, you might find a benefit of taking vitamin C just to help you navigate it, but two, you're probably, because of the toxicity, you're probably being depleted of it. We know that smoking causes vitamin C deficiency. We know that petroleum exposure. How many of you use petroleum-based chemicals like gels and lotions and will rub that stuff all over your skin as a moisturizer? Nonetheless, we're also being exposed, through aerosolization, gasoline and petrochemical byproducts and plastics and everything else. We know that alcoholism and alcohol depletes vitamin C. We know that heavy carbon monoxide exposure can cause it. We know that stress is a big one for a lot of you. And again, stress, it doesn't matter what kind of stress. Chronic stress will deplete your vitamin C. These studies were done originally in goats and animals, and they found that goats under stress, goats can make vitamin C. Most mammals can make vitamin C. They don't have to eat it. Humans, unfortunately, aren't one of them. But in goats can make their own vitamin C. And so one of the things researchers do is they put goats under stress and they measure how much vitamin C the goats make in response to the stress. And you put goats under intense stress, they're making 15 to 20 grams of vitamin C a day. And that's to help them cope and adapt and deal with that stress. I'm a big fan of vitamin C when you're under stress. I take vitamin C when I'm under intense stress. I take more. Usually I'll take it to bowel tolerance, which is just in divided doses, so that's enough vitamin C. Usually it's 1,000 to 2,000 milligrams every several hours over the course of the day when you're under intense stress, provided your bowels don't start becoming runny. You don't want to take so much that you're causing diarrhea. Antibiotics will deplete vitamin C. As we mentioned earlier, pain medications deplete vitamin C, and heavy metal toxicity, so particularly lead. Good research on lead, and actually good research too on aluminum, causing vitamin C deficiency as well. Now I'll just show you, this was just pulled off of PubMed, but these are just some other additional things to take into consideration with vitamin C. Elderly people, not because being older makes you more susceptible, but because generally the accumulation of bad diet over time amplifies in the elderly. And then what happens with the elderly is the average in the US, the average elderly person's on 5+ medications, and many of these medications are depleting their vitamin C. Alcohol use disorders, anorexia, and cancer, we've mentioned. Food allergies, especially if you have a restricted diet. Many of you in mold go carnivore because it's the diet that makes you feel the best. And so, that's a restricted diet that has a potential to lead to vitamin C deficiency. So as I mentioned earlier, if you're doing a restricted diet where you're eating a lot more meat and a lot more animal products, but not a lot of fruits and vegetables, monitor your vitamin C. Unsupplemented parenteral nutrition. So if you've been in a hospital with a tube, pumping nutrition into your body. Restricted diet secondary to inflammation and bowel disease or GI reflux. So if you're on like a diet where you're limiting certain foods that might be rich in vitamin C because it bothers you or inflames you. Smoke or tobacco products, as I mentioned. Medications such as oral contraceptives, aspirin and indomethacin, tetracycline, that's antibiotic, and then corticosteroids. And then those of you with renal failure, and where that really plays out is many of you don't have to have full renal failure to increase your risk for vitamin C deficiency. You just have to have reduced renal function. And a good part of the population does, because 50 to 60% in the US are obese or overweight. with metabolic problems, metabolic syndrome. And what this translates to is you got high blood sugar. And one of the things about glucose in high quantities is it damages the kidneys. This is why so many long-standing diabetics end up on dialysis, because the glucose has just decimated their kidneys over a long enough period of time. But before you're on dialysis, there's years and years and years that your kidneys can take abuse, but it doesn't mean they're working efficiently. And when you have kidneys that aren't working well, one of the things that can happen is you lose nutrients through them. All right, let's talk about how do we eat vitamin C. Mainly fruits and vegetables. I mean, these are your big sources. I've listed some of the powerhouse foods here. Probably one of the biggest, pound for pound is kiwi. What's not on this list is acai berry, which is high in vitamin C as well. Moringa is high in vitamin C as well, not on this list. But again, there's a theory about vitamin C and humans' ability to see in color, and that's that most foods that are rich in vitamin C are vivid colors, the oranges, the yellows, the blues and the purples. These starkly differently colored fruits and vegetables, we believe that humans, because humans lost the ability or maybe not lost the ability, but didn't have the ability to produce their own vitamin C from glucose, developed color vision so that they could seek out vitamin C. Again, this is a theory. They developed it to find sources of vitamin C. So, interesting theory. I don't know how true it is. I don't know how it could be proven or disproven, but I do find that that's a nice tidbit. Okay, let's talk about vitamin C. I mentioned, how do you test? Well, I mentioned some testing before, but how do you test for vitamin C? If you want your doctor to measure it, pretty much the only way they're going to do that is they're going to do what's called a serum test. And if you're looking at reference ranges, a general reference range is like 0.4 up to 2, and that's milligrams per deciliter, and that's in the blood. And as I mentioned before, if you're 0.2 or less, this would be scurvy. And so that's a simple one that anyone can request if you've got insurance, if your doctor's willing to run it. Like I said, it's about an $80 test. Even if you were to come out of pocket and pay for it, might be worthwhile doing. I do see quite a bit of serum vitamin C deficiencies because it's something I do measure. Now, I measure it, but I prefer, and I also measure what's called INA, intracellular nutrient analysis, where we're looking at the functionality of lymphocytes, the white blood cells, with vitamin C. And so this is an outcomes test. It's not really a reference range. It's more along the lines of a test that measures the function of the cell in response to administration of vitamin C. So we give the cell vitamin C, and if the functional outcome of the cell improves, we know the cell's going to do better if we give vitamin C. So then we know the patient's going to do better if we give them vitamin C. But this is, in my opinion, a much more accurate way to assess vitamin C. Now, there's urinary tests that can be done too. There's also leukocyte or white blood cell tests that can be done as well. But finding a doctor to do that, you can ask for it, you could request, but you're going to hit a stone wall most likely. This one you won't hit a stone wall with. This one you can do. You can even do it online, direct to consumer, especially if you go through like Gluten Free Society. We offer an INA that people can run that measures, not just vitamin C. It measures, more than 50 nutrients, but vitamin C is one of them. But that's the way we would test. And in terms of supplementation for vitamin C, there's different forms of vitamin C. There's just straight up ascorbic acid, but problem with that is that for some people is it irritates the stomach. And so it's not generally very recommended. Then there's ester C, an esterified vitamin C. Usually when you find a supplement like this, it's usually got other bioflavonoids like quercetin in it, or rutin or asparagine. And that's not a bad, it's a pretty good form. There's some research that shows that there's some enhancement to bioavailability, but to tolerability. And then there's also ascorbic acid, which I prefer ascorbic acid, but the caveat here is that it's buffered. I like buffered. When you buffer it with minerals, what ends up happening is this part goes away. You don't irritate the stomach because you buffer it, and so it doesn't tend to create any kind of side effect or problem. The other reason I like it as ascorbic acid in a buffered form is because generally you can take it as a powder and it's not so tart or bitter, and it goes down real easy with a little bit of water. You can take it in pill form too, but powder form is going to be, in my opinion, more effective because in the capsules, your stomach still has to break down, your intestine still has to break down, but in the powder form, it's just going straight in. Now, you'll also find out there some liposomals. I'm not sold too terribly much on the liposomals. I just haven't seen them be more effective than pure ascorbate buffered. But also, a lot of your liposomals, the way they liposolyze them is they use corn derivative, and I'm not a fan of that. Those of you who know me in my work, no grain, no pain. I don't like to use products that contain grains, including corn, and so it's one of the issues here where I don't really care for a lot of the liposomals on the market. Most of them do contain corn as part of the process, even if the label doesn't say corn on it. If you call them and ask them how they're producing their liposomal, there's corn in that process. So ideally, this is my favorite. Now, in terms of doses, there's a range of dosing for vitamin C. I think a pretty safe place to be for most people, is about 500 milligrams a day. Keep in mind that the RDA, in the US at least, the US RDA for vitamin C for men is like 90 milligrams a day. And there have been many, many researchers that have said this is way under the mark. And I think for women it's 75 milligrams a day. And I agree. I think these are under the mark. I don't think it's enough. And there's enough ample data and enough long-term data in trials that show that when people do more than that, when people are in the 300 to 500 milligram range a day of vitamin C, there's a lot of benefits that come with that far beyond these 90 to 75. Now, it used to be lower. It was raised several years ago. And remember how these were originally formed. The original US RDAs were formed based on how much was necessary to not have full-blown scurvy. And so you have to understand that when if we're talking about scurvy, by the time a person develops scurvy, the vitamin C deficiency has been going on for a while. But there's a prodromal period between health, scurvy, and then in the center somewhere there's what we call kind of preclinical disease, where maybe you don't have the full-blown hemorrhaging under the skin or the hyperfollicular keratosis and the bleeding gums, but maybe what you have is you have a pronicity to injury. Your collagen is becoming weaker because there's not enough vitamin C to support healthy collagen formation. So maybe just bruise easier. Or maybe your gums bleed sometimes, but it's not as severe as like the full-blown illness. Maybe you didn't develop the severity of pain, but again, there's these preclinical, there's this preclinical area. And so this is where I think most humans should be, is 300 to 500. Now, you could supplement that. You could eat it with your food. I think ultimately you should eat some in your food. That's what food is for. But you might consider supplementation in this range. This is a pretty kind of modest supplementation. So that being said, we talk about therapeutic. How do you get therapeutic with vitamin C? There's a couple different things that you can do therapeutically. One's called a flush. What's known as a vitamin C flush. And this is where you take approximately 6 grams, I know it sounds like a lot, 6 grams of vitamin C every 15 minutes until your bowels start moving, basically until diarrhea. And for most people that are in generally pretty decent health, it takes about 4 doses. So it takes about 24 grams. And for many, it takes a lot less, but these are just generally on average. And then for really sick people, we'll see it, 40 plus. But doing this as an exercise kind of gives you an idea for what your maximum upper intake could be if you just wanted to take more vitamin C. So, so the way we look at this is, let's say it took you 10 grams. 10 grams to flush, then you would then take 75% of that 10 grams, so that'd be 7.5 grams per day. If you're trying, this is like if you're trying to be super aggressive. If you're trying to be super aggressive with your vitamin C and take a really high dose regimen. What are the side effects? If you get too high, you're going to start having a lot of gas and bloating and a potential loose bowels. So you don't want that. So if you do this and you start doing this, what sometimes happens is as you saturate your tissues with vitamin C, less becomes better, right? So maybe you don't quite need that 7.5 anymore. And so over time, over the course of 2 to 3, 4 weeks, you need less because your bowels start to become bloaty and loose. So at any rate, that's where if you want to go really high dose therapeutic, maybe you're trying to support yourself going through cancer, maybe you're trying to support yourself going through some type of autoimmune arthritis. So you can get real aggressive with it, but the way you would do your dose, because dosing is different for everyone, is you try to do a calibration by doing a vitamin C flush first, and it's 6 grams every 15 minutes until you have diarrhea, and then whatever that amount turned out to be, you would multiply it by 75%, and that would be your daily dose then for the next several weeks, and then pay attention. And then you can do a recalibration of this, and usually what happens is the dose comes down with time. You don't need as much over time. Now, if you do that, be aware that you need to stay home and have a toilet close by, because this process for most people takes about anywhere from 3 to 8 hours, and I've seen it take longer, and I've seen it take longer in really, really sick people where it's taken 24 hours. I think the most I've ever seen it take a person was over 150 grams to actually complete the flush, and they couldn't take 6 grams every 15 minutes the way anyway. It's another matter. But my point is, stay home, be next to a toilet, and if you vomit while you're trying to do this, just stop the flush. Don't push past that. It's one of the other side effects that can occur, so don't push yourself beyond that. Outside of that, there are a number of different studies that explore different therapeutic ranges of doses of vitamin C, ranging anywhere from 500 milligrams a day to 5,000 milligrams a day. I think the powers that be make the claim that 2,000 milligrams a day is the upper tolerable level. But I mean, clinically, that doesn't pan out. 2,000 is nothing when you're talking about a sick person who you're using vitamin C to try to support. So the upper tolerable intake here at 2,000. So if you want to play it safe, just don't go above 2,000. But if you want to explore a little bit higher, I recommend you do a vitamin C flush, calibrate your dose, and take that 75. Now, when you're taking that 75%, this again, in the case, let's say it took you 10 grams, and so 75% would be 7.5 grams. You don't take all 7.5 grams at once. The way you would space that out is you'd space that out over the course of the day, typically in 3 to 4 divided doses. So you divide that by 3 or 4, and you take anywhere around 1 to 1.5 grams of vitamin C every several hours. One of the things we do know about vitamin C is that when you get into doses above, if at 3 to 500 milligrams, you absorb almost 100%. But when you go above 500, that incrementally the absorption goes down, right? So above 500 milligrams, the rate of absorption drops. And I think, don't quote me on this, but I think it's at 1,000 milligrams in a single dose, you're actually absorbing about 60 to 70% of that 1,000 milligrams. So just know that that some of it's going to come out of you. And remember, vitamin C is an osmotic, a lot like magnesium. It loosens, it pulls water into the bowel, which is why if you take high doses in short periods of time, you'll have diarrhea. But some people use vitamin C as a laxative as well. They use it as if they're having constipation problems, maybe trouble going to the bathroom on the regular, using vitamin C or using magnesium as an osmotic can be an effective way to push your stool through you. So at any rate, I hope that's helpful for you. It's always best to work with the doctor, honestly, if you're doing higher doses. If you're staying around these smaller doses, it's not a big deal. But if you're going into the higher dose realm, ideally you want to work with somebody who can guide you through that, who's got some experience and can share with you, what to expect. Ultimately, though, test, don't guess. If you aren't sure whether or not vitamin C is the right move for you, consider getting with your doctor and getting a test done to explore whether or not taking it is something that is worthwhile for you. At the end of the day, it's pretty safe at these doses, and it's really inexpensive as a supplement. So there you have it, a breakdown on vitamin C. I hope you enjoyed this course. You can check out some of my other classes on vitamin C here. I've done other dives into other parameters of vitamin C. We could write archives of novels about vitamin C and human health. So check those out here. And if you want to watch more of my nutritional crash courses, you can check those out right here as well. I've got an entire library from A to Z on vitamins and minerals that you can learn more about. Hope this show was helpful for you. Do me a favor, hit that subscribe and like button down below. And make sure if you have a family member that could benefit from this information, share this with them. Together, we can spread the word and help save 100 million lives. Take care, and we'll see you in the next show. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this. And make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.